people are nervous to try Botox. Maybe they don't like the idea of injections, or maybe they want to actually reverse wrinkles instead of just temporarily relaxing them. The good news is there are 3 science-backed treatments that can reverse wrinkles at the tissue level without using Botox. And 2 of these you can even do at home. Hi, I'm Dr. Morgana Colombo. I'm a board-certified dermatologist in Northern Virginia and founder of Vida Derma, a science-backed skincare line aimed to help women as they age. So the 3 wrinkle reversal treatments don't just camouflage wrinkles. They stimulate your skin to build new collagen and elastin, the structural proteins that make skin firm, smooth, and youthful. Let's dive in. Number 1 is using retinoids. If dermatologists had to pick one anti-aging product with the strongest scientific evidence, it would probably be a retinoid. Retinoids are vitamin A derivatives, and the most studied is prescription tretinoin. What makes tretinoin unique is that it actually changes how your skin cells behave. It stimulates fibroblasts, the cells responsible for producing collagen, and it suppresses enzymes called matrix metalloproteinases that break down collagen. And the results are not just cosmetic. A landmark study published in the New England Journal of Medicine found that sun-damaged skin produced 56% less collagen than protected skin. But after 10 to 12 months of tretinoin use, collagen production increased by approximately 80% compared to placebo. That's significant, guys. This means that your skin is literally rebuilding itself from the inside out. So how long does it take for retinoids to be effective? Most people begin noticing improvements in fine wrinkles, skin texture, and pigmentation after, I would say, about 4 to 6 months. Early irritation, redness, dryness, and peeling are common, but these side effects usually improve as the skin adapts. Remember, the prescription retinoids are going to work faster than over-the-counter, but they can also cause more irritation. You can use both of these types at home. There is one over-the-counter retinol called the HPR, which is strong for wrinkle reduction and gentle on the skin. This is one of the key ingredients in the Vida Derma Reverser 1 serum, which I will link in the description below. Number 2, when it comes to wrinkle reversal, is a big category. This is in-office procedures like lasers, microneedling, and energy-based devices. Fractional CO2, erbium lasers, non-ablative lasers, standard microneedling, and radiofrequency microneedling all work through the same principle: control the injury to the skin. That may sound scary, but it's actually how many of the most effective wrinkle treatments work. When tiny, precise areas of skin are injured, your body launches a wound healing response. Growth factors are released, fibroblasts become activated, and your skin begins producing brand new collagen and elastin through a process called new collagenesis and new elastogenesis. Fractional lasers create microscopic columns of injury while leaving surrounding skin untouched. This speeds healing while triggering deep remodeling. Studies show collagen types 1, 3, and 7 remain elevated for up to 6 months after treatment, while damaged elastic fibers are replaced with new ones. Microneedling produces a similar effect. By creating thousands of tiny channels in the skin, it stimulates collagen production and fibroblast activity. Some studies have found collagen and elastin levels can increase by as much as 400% 6 months after treatment. And when radiofrequency energy is added to microneedling, the effects may be even greater. Research suggests radiofrequency microneedling not only increases collagen and elastin production, but may also reduce the number of senescent or aging fibroblasts in the skin. The catch? These treatments usually require multiple sessions, and results continue developing for weeks to months after treatment. Finally, number 3, this is chemical peels. Chemical peels have been around for decades, but many people underestimate how powerful they can be when it comes to wrinkle reduction and reversal. So a peel doesn't fill wrinkles. Instead, it removes damaged tissue and forces the skin to regenerate. There are three main categories of chemical peels. You have your superficial peels, usually use glycolic acid, and this type of chemical peel improves texture and fine lines with very little downtime. Medium depth chemical peels, commonly using about 35% trichloroacetic acid or TCA, and this type of chemical peel penetrates deeper. Histologic studies show they increase dermal thickness and they stimulate new collagen and elastin formation. These peels are particularly effective for mild to moderate wrinkles, but the most dramatic results come from deep phenol croton oil peels. In a classic long-term study, researchers found these peels created a completely new band of connective tissue beneath the skin, measuring 2 to 3 millimeters thick, packed with newly formed elastic fibers. Even more impressive, those structural changes persisted for up to 20 years. For severe wrinkles around the mouth and eyes, deep chemical peels remain one of the most effective single-session treatments ever developed. But these peels can have serious risks. Deep chemical peels can cause prolonged redness, scarring, and even heart rhythm abnormalities from phenol absorption, which is why they should only be performed by experienced physicians with proper monitoring. Interestingly, a recent systematic review found that lasers and chemical peels provide comparable overall improvement in photoaging. Lasers often require fewer sessions, while chemical peels are generally less expensive and simpler to perform. Retinoids, lasers, and microneedling and chemical peels don't just hide wrinkles, they activate your skin's natural repair mechanisms and stimulate the production of new collagen, elastin, and other structural components that make skin stronger and more youthful. In other words, they're not masking the wrinkle, they're rebuilding the tissue underneath it. Best option for wrinkle reversal depends on your skin type, how severe your wrinkles are, your budget, and how much downtime you're willing to accept afterwards. And there is no treatment that can outwork chronic sun damage. Daily sunscreen, guys, remains the single most effective anti-aging treatment to keep your skin looking young and allowing you to maintain the benefits from any anti-wrinkle treatment. What questions do you have? Drop them in the comments below, and I will do my best to answer them in a future video. Remember to hit like and subscribe, and I will see you in the next video.